Welcome to Global Voices, the critical knowledge podcast, loud and clear from the world to you.
With Global Voices, we aim to bring together experts, activists, and students for forward-thinking and cross-boundary discussions about topics of global relevance. I'm Sasha Husenbeet, and I study social psychology and international studies at Roskilde University in Denmark. And I'm happy to introduce you to our podcast.
Hi, my name is Juan Camilo Reyes. I'm from Colombia. I'm a student of Just Science in the University of Los Andes.
And I'm Shreya. I research student activism and universities, and I'm from Tata Institute of Social Sciences in India. The three of us together welcome you to the first episode of Global Voices. With most of us quarantined at home, uncertain of the future, and with testing times ahead, it is natural to feel blue and maybe even panic a bit. In such times, however, it is equally important to understand the situation and its implications. The novel coronavirus has infected more than 200 countries and over 1 million people all over the world. The outbreak poses critical challenges not only for the public health and medical communities, but for each and every individual. These new changes are making us unsure about our lives. To make sense of all that is happening, we got in touch with researchers and activists of various fields from all over the world to deliberate on the global pandemic. Beginning today, in the course of the next few weeks, we will discuss important aspects of the current crisis, some of which don't receive enough attention presently. We hope to capture from the most basic, momentary, and individual concerns to the larger global picture. In this way, we wish to generate insights and discussions that will encourage listeners to free themselves from the atomized realm of their rooms for a moment and consider the planetary implications of the historical moment we are currently living. Today, we start with the basics. There are some questions that bother us all. Will there be a cure? How long will the panic last? Will life ever get back to normal? Or do we have to start imagining a new normal? To answer these questions and some more, we have with us epidemiologists Maarten and Catalina. We welcome you both to our show.
So, our first guest is Catalina Gonzalez Uribe, Associate Professor of Public Health at the School of Medicine at Los Andes University. Leads the development of postgraduate programs in epidemiology, conducts research on social inequalities in sexual health, reproductive health, and vector-transmitted disease. Directed the components of contraception, fertility preference, and maternal health of 2015 Demographic and Health Service (DHS) for Colombia. Passionate about interdisciplinary work, the development of social indicators, and mixed methods research. Member of the Urban Health Research Network in Latin America and the Caribbean. Studied Anthropology, Psychology, and Masters in Anthropology at the University of Los Andes, Masters in Social Epidemiology, and Doctorate in Epidemiology and Public Health at University College in London.
And our second guest, who's with us right now as well, is called Maarten van Wijhe, and he is a postdoctoral researcher at the Department of Science and Environment at Roskilde University in Denmark. Maarten is originally from the Netherlands and studies infectious diseases, which is his main field of expertise, epidemiology. With a special interest in vaccinations, his research focuses on infectious disease modeling and vaccine-preventable diseases. Maarten has researched the impact of vaccination programs, vaccine economics, and government expenditure, where he has a particular focus on researching the effectiveness of vaccination programs. He also has insights on infectious diseases from a historical angle, for example about the 1918 influenza pandemic, and has been interested in studying infectious diseases since he was a child. And our first question is going to be to you, Maarten, and it's just about you. What has gotten you here as an expert on epidemiology? What has sparked your lifelong interest in studying this? And what do you want to get off your chest?
Well, that's a big question. First of all, thank you for inviting me to this podcast. I really look forward to working with all of you over the next coming weeks and see what kind of interesting discussions we can have here. So regarding your question, well, actually my interest in infectious diseases already started when I was pretty young, during my years as a small student, when I was 12 years, 13 years old or something like that. I saw this this movie called, I think it was Outbreak, where they also where they had this epidemiologist combating some Ebola-like disease, and I thought, yes, that's cool. That's what I want to do. I want to study infectious diseases, and I want to be like this person. I didn't really end up like this person, since he really was out in the field in the tropical rainforests and things like that, and I figured out that's probably not really what I really want to do. So I rather sit behind a desk, behind a computer all day, doing calculations, statistics, gathering information about infectious diseases, reading old books, diving into databases, and trying to figure out a little bit more about what we can learn from basically what has gone on in the past in terms of these infectious diseases. So that's what I do on a day-to-day basis, and that's also why I find this so incredibly fascinating, because what we can do in the future, what we can do now, is wholly dependent on what we can learn from the past. So if we get some more insight from what happened in the past pandemics, in the past epidemics, then perhaps we can better get a grip on what's going on right now and what's going to happen in the future.
Yeah, I have a short follow-up to that, which is, it struck me as interesting and as curious that something that might have been quite, a niche or maybe even boring to a lot of people, which is statistics about diseases and things that we have considered to be problems of the past, because now we have the World Health Organization and we have modern science, and things that we either have taken for granted or that we have found boring, like statistics about diseases, have suddenly become the center of attention of the whole world. And in a way, so you, who was previously, not in the spotlight, has moved in a way into the spotlight. How does that make you feel? And yeah, how do you relate to that role?
Well, you're certainly right that history of infectious diseases, or how would you call it exactly? Let's just put it as history of infectious diseases. It has certainly be a sort of a niche field in epidemiology, and basically in the world in general, and not so much because people don't value it, but more because people think or have this feeling, at least that's how I have always encountered it, as well, that was 10 years ago, that was 100 years ago, 200 years ago. You cannot possibly translate what happened then to nowadays. We're better off researching what happens now. However, when we're talking about these kind of pandemics, and especially nowadays, people have realized or start to see that, oh shit, we have this big outbreak now, and we really don't know what's going on. So we need to get some information somewhere, and the only way to get that information right now in this critical time where it is very difficult to get accurate information what's going on right now, we better look at the past. And so what they've also realized with this outbreak, with the coronavirus now, is that we can actually look at, for example, the 1918 Spanish flu outbreak, pandemic, and see what happened back then, and see how did society react, how did we do with all the mitigation strategies, these strategies to try to prevent the disease from spreading. How did we do it back then, and can we learn a little bit about how we can maybe do it right now? And so that's, I really think that these big shocks to society, like big pandemics, highlight the need for our understanding of these past outbreaks. Whereas if we don't have an outbreak, people really don't see much point of it.
Yeah, I think that's an interesting observation. And now moving to Catalina, our guest from Colombia. Hello again. What I thought, I mean, I have basically the same question to you about your background, but what's interesting about your background is that, as opposed to Maarten, you have not been your whole life working on this, but you have made a sort of an inroads into the field after having previously studied anthropology and psychology. And I wanted to know what has made you take that inroads, and how do you, since you are passionate about interdisciplinary work, how do you make connections between the human studies, which is anthropology and psychology, and the study of epidemiology, which is of course also about human beings, but from a different angle. So how do you connect them?
Thank you, Sasha, Andrea, and Juan Camilo. Very happy to be here with you. This initiative is fantastic. Thank you for inviting me. Well, these are clearly interesting questions. You're making me think a lot. While Maarten was giving his response, I was going back like 10 years, 15 years. I had a flashback to starting university degree. And well, what has always attracted me and has fascinated me for a long time is human behavior. And anthropology was my venture into that field of knowledge. Why do we as individuals and in our own cultures and societies behave in certain ways? And health has been perhaps one of the most enigmatic areas of behavior for those of us who are interested in social sciences, as you mentioned. Health implies many perceptions, actions, knowledge, and even feelings as crucial factors that determine the way we make decisions about our own health and the health of our groups and societies. So I guess that's how I started first with this passion of trying to understand human behavior. Then I discovered health as being this huge area of knowledge where human behavior was almost unpredictable. And then as I was doing my studies from a qualitative point of view, I realized that you also need data, you need facts to provide very good information for health policy leaders. And that's when I had this, you would call it change or jump. I feel it's some form of kind of mutation, trying to adapt to the new questions I wanted to ask myself. So it was no longer why, but I also wanted to quantify how probable were those behaviors to be shared by larger groups in society. And that's how I moved into epidemiology. And I feel it has been a fantastic journey. I think if you just stand on one of these two areas, I mean, just on social sciences or just on data science, you miss out a lot of the interesting questions that many of your colleagues are asking from different fields of expertise. So going back to your question about interdisciplinarity, clearly I think that is what really fuels my interest, my daily interest in trying to understand our behavior as humans when it comes to decisions related to health. Data can give you like the structure of the building, if we can think of a way of putting this into a picture. But then if you want to get the color, the depth, the three-dimensional, perspective of that building, then you need to go and ask people why they do that, how they feel about it. And that's how I combine both areas. And I always try to work collaboratively with people that have very different forms of knowledge and expertise.
So yeah, I really like that metaphor with the mutation. The kind of complementarity of qualitative and quantitative information is also something that we've considered in structuring our podcast, where we basically want to move from the basics about this this virus to more wider implications or even more personal implications in later episodes. And so I think when it comes to the historical background,
I have a question for both of you, and it's what are the important things that people should talk about right now? Because people doesn't know what's going on in the future, and a lot of information is right now in the air. So I want to know what are the most important things to talk right now.
Okay. Thank you for that question. I think it's a very interesting one. And the first thing I would say here is that people here should be definitely categorized as a different sort of levels. Are we talking about people working in government? Are we talking about people working in public health, researchers, or is it the general public? So if we're talking about, let's just talk about the public health officials first. Well, the most important thing that right now I think that they should be talking about, and that's also what they're already doing, is how can we, for example, in Denmark, open up society again after having very strict mitigation strategies in place for some time. How can we slowly open up again, make sure that people go back to work without increasing the number of people that actually really get ill, at least not too much. And so that's something that they really should be talking about, and that's also what's happening in many parts of the world, at least those parts that are already this far in the outbreak, that they can think about starting to release some of those restrictions. Others will still be thinking about how can we actually make sure that our healthcare system is not collapsing under the pressure of new cases coming in every day. So that's I think what they should, what's most important for them right now. For researchers, there are still so many questions about the coronavirus that we don't have any answer to. What is immunity? How long does immunity last? Are we actually immune? How many people are actually infected in the population? Those kind of questions are very important. Development of vaccines, what's the best strategy to go about that? Are there any treatments that we can use quickly now before we have this vaccine available? What's going to happen in the near future when we start opening up society again? How many people can we expect to be infected? Those are very big questions that still need answering. To some degree, we know answers, but to a large degree, those are still open questions that need more research. But for the general public, that's sort of the last tier. I would say, well, I don't really have any big questions that they should be asking right now, except how do we get back to work, and let's just hope for the best. So maybe Catalina has more insight about that in terms of human behavior.
Thank you, Juan Camilo, for your question. I agree with Maarten that we need to think of, well, who do we want to ask these questions to? You know, it's going to be very different depending on the audience. But if there's anything I've learned from my anthropology studies, is that we also need to think of this in terms of time. We have questions that we need to ask ourselves in the short term, and we have other questions for the long term. So there's a need for immediate responses on very basic things like logistics, like health provision of services, like mental health of everybody, of the health professionals, of those who are suffering, of their families, trying to understand this problem, the social phenomenon, from very different angles. Those are the short term. We need to look at those very quickly. We need to address that. There's this huge competition right now in terms of markets where presidents are calling directly, the industry, the fabrics that produce the ventilators, that have the face masks, because they have the money and the power to do so. So those are relevant questions that set us back, to other questions that have always been there present. And how do we balance this issue of power around of what we can buy in terms of health provision and things that we need to secure structurally to have our populations in more or less good living conditions. So our countries are, I'm thinking in terms of Latin America and of course other regions in the world, we're now seeing what it is to live many years without enough investment in science and in health provision, and specifically without a better investment in the quality of life of our populations. We can't solve in a month the lack of infrastructure that we have, the lack of science that we have, the lack of quality of, you know, good drinking water for our populations. And this pandemic has just pushed us against the wall when it comes to this. Now we're feeling that. We're seeing the burden of not investing in that. And we may not have enough resources to acquire everything and on time to save enough people. So those are, for me, urgent questions that need to be addressed right now, but that will leave us a lot of tasks for everybody, from wherever you're standing in society, either academic or not. In the longer term, how are we going to be prepared to face something like this in a few decades? Because it's going to happen again. It's happened before. This is not the first time. And now more than ever, we're traveling so easy and moving around the world so easily that it is even more likely, you know, for this to happen again, even though we have the modern science. In the long term, my question for the long term for the different audiences would be, well, what do we think is normal life? Because we're wishing to go back to, you know, out on the streets and live our lives as we used to be. But I don't think that's going to be the right way to look at this. Our lives have changed. The world has changed. I don't mean to sound negative or doomed, but it's not that. It's that we've been faced with something that we had to stop our lives to understand what is going on and to make important decisions of getting together and protect ourselves. So by staying home, we're saving lives, right? We're saving health professionals from the burden. We're saving our governments for, you know, from high economic and social burdens. But we're not avoiding everything. I mean, it's impossible to prevent all that's going to come afterwards. So my question on the longer term, because it's going to take some time for us to understand this, you know, to digest this information. You can't just have a philosophical change, you know, in the way you view life one day to another. It's going to take some time. Younger generations are going to understand this in a different way. What is going to be our normal life? What is going to, things that we've taken for granted, we need to rethink that. Look at the fantastic changes we've seen in terms of ecological indicators, you know, of wildlife just running around, even a drop in temperature, because we stopped doing a lot of things. But we can't just, you know, never do that again. We need to fly again. We need to be together again, because human beings are social, you know, animals. So we need to interact. We'll need to do that, but we need to think of that in a different way. And that would be like my basic question, a very philosophical question for everybody, depending on where you stand. Short term, how are we going to deal with the, you know, with the life crisis we have at the moment?
Okay, so right now the most important thing for general public is think what is coming on in the future, no? Like, well, I think that the people need to start to think about that in the past with the other pandemics, like Martin talked about the Spanish flu. Like, I think we have some examples in the past, like when the people need to start to think about the future. It's the I think Shreya has a question about that.
Yeah, so what I also wanted to ask earlier, that Martin says that the Spanish, like he studied the Spanish flu, and Catalina also looks at anthropology. So I have this question that like we understand, like how Catalina very nicely put that we don't know what the new normal is going to be like, and it's something that we are all going to think a lot about, and this is something that we are all going to face. But I also wanted to know that how special this pandemic is. Like, were the earlier pandemics less devastating, more devastating, or like how were they different? And is this something very unique? Like for our generation, it is definitely very unique, but is it very unique for like human history in general?
That's a good question, and I do think that this pandemic is unique in a couple of ways, actually. First of all, it's the way we react to it. That's basically number one. We've had big pandemics of respiratory diseases before. We had the 2009, that was the most recent one. And then we have had a couple of other influenza outbreaks before that, the Hong Kong flu, the Asian flu, and then we had, of course, the Spanish flu in 1918, and before that we had Russian flu as well in 1889. So yes, there have been a couple of big of these respiratory pandemics, and I think the main difference here for this one is, if we're talking like a little broader perspective, is how we responded to it, because as Catalina also mentioned, we travel a lot more. So this pandemic traveled so fast around the world that basically in a couple of months it was everywhere, and that is a speed that is pretty damn fast. Also in a historical perspective. Now these pandemics, they tend to travel quite quickly across the world, but I think this one caught us off guard in some sense. Even though we saw it coming from China, we were not preparing well enough for it. Even though we could see what was happening in China, we were not doing enough in the rest of the world, basically, in order to prevent this one. So how we responded to this one is very interesting and very different, in that sense that we did know what was going on, but we, in many cases, didn't really do much in order to prevent it. We underestimated the threat in that sense. And when it actually did turn into a pandemic, did turn out to be really big, we instituted, we in a general sense in this case, very strict mitigation strategies that in terms of when we did them in the pandemic were actually rather quickly. For example, with the Spanish flu, some mitigation strategies were only enacted very late in the pandemic, whereas now in some countries they were actually enacted pretty early. So that is very interesting to see how that relates to those older pandemics when we actually start to take action. And I don't think that we've ever had actions on such a global scale in such a short amount of time towards a pandemic before. And that is very, very interesting. So we will see that this outbreak will have very, very major consequences in terms of how we look at pandemics, how we respond to pandemics, and how we actually behave during a pandemic. And that is, I don't know how that's going to turn out, but it is very interesting to follow what's happening. So that answers a little bit on a more broader perspective.
So I thought it was interesting that you said that it caught us off guard, especially because you're an epidemiologist, I would suppose that you have been sort of wondering about in the past and expecting the next pandemic, or thinking about the likelihood or the possibility of a new pandemic. So were you caught off guard as well, or do you think you were sort of how was that moment for you when you when you saw it transpire?
Well, in that sense, you will always be caught off guard, I think, with a pandemic. Because
So, Catalina,
if you're not caught off guard, you can stop it, basically. So, but in that sense, what I mean is that, yes, we knew for many years already that there would be another pandemic. Basically, there will be another after this one. That's sort of a fact, that's a given. And we actually, for many years, the WHO has categorized this thing as disease X, like the unknown next big thing. And that turns out to be this one. And there's going to be a disease Y in I don't know how many years. But the
I was thinking if
being
you
caught off guard
also have
means
to add
more
into
like
what
we know
Maarten
it's
just
coming,
said.
but we don't know
I
when.
mean, there are a lot of nice points but I was also thinking if you could throw a little light on the socio-political aspects, like given that we travel more and it traveled faster, what are the anthropocenic reasons that you think influence this pandemic and the outbreak that we have right now?
Sure. I'll go ahead then. I think Maarten made some very important points in terms of were we expecting this, were we prepared for this. The level of of the crisis is definitely something that we were not expecting to have. We trust modern science. We trust the enforcement of certain policies to control of this. But what we usually miss is the unpredictable human behavior, and that's exactly what happened. We close frontiers. We tell people to stay at home. We have all these rules, but we cannot predict what the leaders of the world are going to say and how that's going to trigger certain responses in different areas. But let me go back a little bit to the first part of your question. Have we seen something like this before? Well, we have. We've had pandemics before. I do think there are key elements that make this one slightly different. One of those is social media. All the the use that we all have or make, and the possibility of communicating 24/7. That has clearly made this pandemic something different. In terms of numbers of deaths, for example, well, you mentioned the Spanish flu, and you're correct there. We lost almost or around 50 million lives back then in 1918. That is a very big number, and I'm sure it's underestimated because, as you may be aware, there are difficulties in terms of measuring this. How do you measure this? Do you have all the right numbers? For epidemiologists, like our if we had any 10 commandments at all, number 2 and 3 are clearly what's the numerator and what's the denominator. And I think that is another difference. I think compared to 1918 with the Spanish flu, and even with aviar influenza in 2009, MERS 2012, well, Ebola 2013, Zika virus not so long ago, just 2015, we clearly have much more decades of research, of more sophisticated tools of diagnosis and of measuring. So our numbers should be slightly better compared to those at the beginning of the 20th century. I'm thinking about the Spanish flu, but that doesn't mean we're missing out certain vulnerable groups. I'm sure we always have this possibility of bias, of measurement error. And I think that's another feature that makes it slightly different. We can have on real time horrible statistics of what's going on, and we use that on the media all the time. So that's different from 1918. We have a lot of, you know, loss, grief, disease, deaths, but we didn't have those numbers on real time on the internet. And I'm sure we're making decisions differently. It's very easy to scare large groups of people. We need to think of the information we provide to the general public. There are ethical issues involved that might make this pandemic slightly different. Not that we didn't have those ethical issues before. It's just, it didn't happen so quickly. It wasn't, you know, you just need to check your mobile phone before you go to bed to see what's going on in the UK, for example, you know, in Asia. And then you wake up and you check what's going on in New York, and it's non-stop information, statistics developing all the time. And that must have a mental health burden that we're not taking into account, that I'm sure it's slightly different. Not that we didn't suffer from it, but in slightly different ways. That's what I'm saying. We're facing the phenomenon in a different way. In terms of loss, I mean, I have this table that I can share with you. Though we're trying to summarize 20th century. So we have Spanish influenza 1918, then the Asian influenza, the influenza Hong Kong, then we have HIV, and all these first four were considered global phenomenon. So there were, they involve, you know, countries globally. With SARS, you had around 37 countries with real numbers and statistics regarding SARS. Avian influenza global again, MERS was 22 countries, Ebola 10 countries, Zika virus 76 countries, and we're talking around 205 countries when it comes to COVID, and clearly a global effect.
I think it's interesting, the points that have been made by both you and Maarten in the last few minutes, especially when you put into perspective the numbers of deaths from the Spanish flu 100 years ago. First of all, the numbers are already large anyway. Then in relation to the different population size, they're even bigger. But what makes that interesting for me is, you know, one of the biggest points that was made in the early outbreak of this disease, COVID-19, was, well, it's just like the flu. And isn't that, I mean, it seems a bit absurd when you put into perspective the actual destructiveness of the flu in the past to say, well, it's just like the flu. Because if we then would say, well, it's just like AIDS, then it would sound very differently, because the word AIDS has very different connotations than the flu. The flu has, you know, sort of been forgotten as how impactful it really was. And so that's why I think the purpose of today's episode is to create a certain historical awareness, precisely because of this strange way that we have of relating to history. And and this is why I would return to Maarten's point about being caught off guard, which has to do with the timing of it, and connect that to Catalina's point about the sort of the media spectacle that we experience, because social media being such a large factor in our lives nowadays, combined with this pandemic, not only in terms of political and mental health, but also in terms of how it shakes our most fundamental beliefs. Because when we talk about neoliberalism, we often already observe an increasing precarity of a lot of people's lives, and this precarity has now crept into their bedrooms, like you say, Catalina, into their atomized small apartments where they are quarantined. There's a constant precarity, and Yeah, I would just like to open the discussion with a very broad question. What do you think are the future implications of such an extreme feeling of precarity that basically plunges right into a society that was very, in a way, assured and confident in a lot of ways about its capacity to deal with things better than in the past?
I think that's again a very very good question. And I first actually would like to go back to what Catalina said, that indeed communication has changed, and that's probably one of the main differences that we have now compared to many past epidemics. Still, the social media, as she explained very well, and I think that's exactly precisely one of the things that you're also tying into with the mental health problems and how we should deal with that, how what can this have for future implications. One of the things that I think is very interesting in this as well is that social media is not just a tool to get news from or to keep updated, or in this case also to have these maybe more adverse problems with it as well, increasing stress during these times. But social media and apps and mobile phones can also be used to help combat these kind of outbreaks, as what they are doing now in some countries. I think it's Singapore and China, where they have apps to track people, who they come in contact with, and if they're sick, then they can very quickly, through this app system, send out notification to people like, oh, you've been in contact with someone who has been ill, you should quarantine yourself. So there's also another side to the social media, to the connectiveness that we have now with the changes in technology. Doesn't mean that that might be a good idea. I'm a little bit impartial to it. It has a lot of problems with privacy, security, and all that kind of stuff. But there is definitely a change for both the better and the worse in terms of social media use and in terms of new technology adoptions. And but one of the other things that you mentioned is also the link to the AIDS. And I think there might be a link that is maybe not as obvious, and that has to do with stigmas. And what we saw with the AIDS pandemic is the very big stigma that it was associated with it, mainly an outbreak among the gay communities. And there was a very big stigma associated with this AIDS, having AIDS, and that you could transmit it by whatever means. Oh, you shouldn't touch anyone who has AIDS, you shouldn't touch gay people anymore, because then you get AIDS and you will die. Those stigmas are luckily, at least not completely gone, but luckily they're less now. But we also saw these stigmas here with this pandemic. For example, in the early days here in Europe, where people who traveled to northern Italy, where the outbreak basically first started, if they traveled to northern Italy to go on a skiing holiday, for example, and came back from there was a sort of social stigma to it, because people didn't really want to contact too much with the people coming back from holidays, because, oh, you might have this new disease because you went to this to the country where there's this now the epicenter of. And there were more stigmas associated like that, in that sense. If you were tested positive or if you were quarantined, then maybe even after the quarantine is over, people might not be willing to associate too much with you. So I think that also is a very important aspect that also ties into the implications that these outbreaks have. And I think one of the big ones is in this increased focus on mental well-being that may have been overlooked in many other pandemics in the past, and that has now seen an increased interest. What does this actually do with our stress levels? What does this actually do with how we deal with it, and how do we cope in the future? especially, for example, for healthcare workers who are now working in the first line, dealing with all these patients. It's an enormous stress. They work long hours, they have to deal with death and very sick patients every single day, not just with the patients themselves, but also the risk that they have on contracting this disease. So I think the focus on mental health, as has been mentioned by Catalina, is actually going to be one of the more future implications that this big outbreak has. And the last part that I want to add here is something we haven't touched upon yet, is the economics of it. Because there's now a lot being written about, yes, we have this big pandemic, but how much can we actually do in terms of locking things down? How much do we actually want to restrict our society and restrict our economics? What cost do we want to pay in order to stop this outbreak? There's a lot being written right now about that, and I think that the final answer about that is definitely something that's not being given yet, and I don't think it's possible to give a good answer to it, but it's definitely something that we'll see a lot more of in the weeks and the months and years actually to come.
I agree with Martin's view absolutely, and I would like to add perhaps two ideas to what he just shared with us. And I'm thinking of the word precarity that you used, Sasha, while asking us about COVID-19 and the world right now. I think that there are two key things going on, two pieces of information that I've seen in many of the newspapers around the world that I've been looking at. And one key thing, and it's related to precarity, is how the enormous level of interdependence that we have as human beings. I think we've taken for granted that we are interdependent. We depend on each other to survive. We cannot survive alone. We are a social species, so we need one another. If someone is suffering, if there's an economic collapse somewhere, all of us will be affected in different ways. So precarity, particularly for all of those in informal jobs, entrepreneurs, independent, people who've always been vulnerable, who've always been left out of these statistics. So who have to go and earn their living on a daily basis. They can't really plan, they can't save. These are the populations that are always put on the spot. And COVID-19 has shown how large is that interdependence, because it's just not only them who always been vulnerable economically and socially, but all of us. This is like domino, pieces. We depend on everybody throughout the world, globally, even though we'll never get to meet everybody. We'll never get to travel to all of these places. Something that happened in Wuhan, China, has affected everybody's life. So the interdependence of our human existence, I think that's a major point here, because it has changed the way, we interact with our families, the way we think about our jobs. I think there have been very interesting discussions going on that how many of us will have different views of life, different jobs after we somehow survive this COVID phenomenon. Many of us will play a different role in society. And that happened because of something that in less, than a year changed dramatically the way we see life. So that's one key thing, the interdependence of us as human beings. And then the second key point that I wanted to point out, it has to do with mental health as well, but I think we're going to see two extremes here developing. We're going to see a lot of solidarity on one hand, but we'll also see a lot of selfishness. These are just two ways of reacting to the whole thing, two ways of panicking. The interdependence should teach us that we need to be, that we need to consider the other, that we need to think of solidarity as a way of surviving, that we need to think of flexibility, of adapting, mutating to actually survive. So not the fittest, not the strongest, not the richest, but who's going to be able to adapt, to be more flexible. Flexibility of mind is going to be key to survive. And this is not new. I mean, these are words that have been linked to Darwin's work and biologists before them. This is not news for us. This is just someone throwing it at our faces. You either collaborate or you take the risk of not surviving. But we will have both behaviors. We will have those governments that will do anything to have their own people survive at the cost of others. And those political limits, I think, are going to be very fragile at the moment. And I think Europe is a very good example right now. Between Italy, Spain, Germany, UK, and everything that's going on at the moment, all those key political decisions that are being made, they have to do with solidarity, they have to do with selfishness, they have to do with trying to adapt and survive. And at the end, that's what's going to really take it's going to be the biggest factor in consideration. Those two would be like my big concerns in terms of the future. So the interdependence and these opposites, of solidarity and selfishness.
Yeah, thank you, Catalina. I mean, whenever I think of what will happen once the quarantine period is over, I think the dichotomy of interdependence and selfishness is one of the most striking things that would come out. One of the easiest ways to look at it is right now that just us being well and maintaining social physical distance and everything is not enough. Like we also have to ensure that everybody else is also well so that we remain well, which leads to the idea of public health care and all that. So I think, yeah, I mean, thank you for bringing that up here. I also wanted to know about this actually from both of you, given that you both are considered one of the most knowledgeable people right now because of the profiles. So there are, how do you tackle with fake news and misinformation and everything that comes up? I mean, you mentioned social media and you mentioned newspapers, but then, and interdependence, but then like suddenly there's a news that, Chinese sent it to, I don't know, because of their eating habits or because they wanted to do this, or maybe drinking bleach solves it, or this is just a plot to remove you from God so that you cannot visit churches. So these kind of instances that come up. So yeah, like what is your take on it? How do you think we sift these problematic news that come up, and yeah, like how do we avoid this?
Yeah, fake news.
Well, fake news is a very dramatic but also fantastic phenomenon if you think of it. It's why are we so obsessed in trying to explain everything? We are obsessed with the idea of we need to find the cause, behind of this. Epidemiologists, we do that all the time. I mean, the creme de la creme here is trying to find this unique causal factor. And what history has taught us, and science as well, and is that it's very difficult to pin down everything to one single thing. There are many, many factors affecting all the things that happen all the time. And fake news is actually one way of reacting to this. What is fake? Do we need to read only the newspapers? Is this the real news? Don't they also sometimes get involved in fake news, maybe without even knowing, or by purpose. So then it comes to this, what anthropologists love is the relativism. It's like 100% relative. Everything is relative. You know, it depends on where you're standing. There is clearly a lot of fake news that can make a lot of damage, that can hurt you. And I think it takes experience. It takes years to actually decide to filter, you know, what is this good or bad news. Even from the most prestigious newspaper, you can get information that can make you, that can bias, you know, your own thoughts, that can make you struggle with what you believe in. So it's very difficult, I think, to sort this out. I think there are also some political interests behind this. There could be economic interest behind the fake news, but it's like a game, and the rules have changed. There's always been this attraction, you know, by humans to have the information. Information equals power, you know, like with data. If you have the data, governments usually in Latin America, they don't like sharing the data. Data means power. The statistics, knowing the status of your population, means you have control of this. So fake news is also a way of reacting to this, you know, creating turmoil around this. Who has the real data? Who has the real information? I don't think it's something you can really stop. I think it depends on what you're looking for. If you want to understand how communities are reacting to this, then fake news is a good form of data to study this. Yeah, so you can think of fake news as data, as an object of study. But if you think of fake news as something that you want to use to inform yourself, then you could have many sources of fake news, and it's very difficult to decide which one, you know, is the best source. Here in Colombia, and I'm sure in many other countries, very important newspapers have had their occasional, you know, misunderstandings in terms of sources and the information they've provided. So we're not free of making those mistakes. It's a complicated question, the one you've asked. I don't know if I've provided some light into this, but I think of this in two ways, you know. Fake news as an object of study, clearly, as something showing how we want to fight this idea of data or information as power, as control. And on the other hand, how do you deal with this? Because you don't want to go mad around this. And even there's been advised in many countries that if you want to stay healthy mentally, you need to limit the amount of time you spend on the internet. You need to limit the amount of time that you listen to the news to, you know, the minimum. Because you can lose track of time. You can lose track of your own sense of how you feel towards this situation. I'll let Maarten jump in.
Yeah, I completely agree with what you say, that you have a couple of different kind of sources or ways of looking at the fake news, as either a study object or something that you absorb and you use. I also would like to add something else, and that it has to do with trust as well. How much do we trust our data sources or our news sources? And what is interesting, I think, is that there might be actually an increase in trust. Now, I don't have any data to support this, but there might be actually an increase in trust in governmental sources during times of crisis. And maybe you know a little bit more about this, Catalina, but and as far as I understood it, when there's a crisis, people tend to flock towards leaders or group leaders or governmental persons, at least someone with authority and someone with more power. And in terms of fake news, it actually might be utilized to try to mitigate that a little bit by governments or by organizations in authority who have maybe more access to verified news sources or verified data sources to actually inform the public in a better way and try to circumvent to some extent the news that's being spread on social media and other platforms. That doesn't mean, of course, that that's perfect and that it will work very well. And fake news is a big study area, and the last, it's been actually also a big problem that has been increasing over the last years. And I don't think there's any good way that they found to try to reduce that or mitigate it. So that's a little bit that what I wanted to add there. Actually, I also want to add one caveat on something that I said earlier about the stigmas and relating it to AIDS to AIDS. I don't want to give any impression that I equate the two, the stigmas that we see nowadays with the sickness of AIDS. Absolutely not. Those two are very different. It's just the idea or the link that there might be a stigma now with the quarantine and the corona as well. So that's one caveat that I wanted to add to what I said earlier. With fake news, that's I don't have much to add to that besides what you already mentioned, Catalina.
Okay, so before we go to the next question, I just had a small point to add to Catalina's, actually, when you replied. So I was like, I think maybe the way you presented, I was kind of reminded of Malinowski's Magic, Science and Religion, like, which is one of the most basic readings for human societies. And I mean, like, kind of one of the points that come out from the book is that science stands for how much you know, like all that humans can answer is known as science. And then once it goes a little beyond, we turn towards magic or religion. So he gives a nice example of fishermen. When they would go to fish close by, they would just depend on their expertise to get the fish. But when they had to go to the high seas, they would pray to gods because like they couldn't predict the high seas, and they didn't know what kind of difficulties they would face. And it's like very simplistically put, it's like complementary, like till you know it's science, and beyond that it becomes magic or religion. And I think fake news kind of works like that, like till you know what is happening, you give news, and once it goes beyond, you just start thinking of anything, and whatever would be more believable, you just try to pass that off as facts. I mean, it will be very wrong at very levels, but this was just one thought I got when Catalina answered.
Okay, so...
Yeah, sure, yeah, thank you. I agree with that.
So I want to return to something that both have spoken about, and that is the response of people to crises like this. Maarten mentioned the stigma that was generated around the gay community by AIDS, and Catalina mentioned the selfish response of people to moments like this. So I want to ask you, what negative response do you expect from people in this crisis? Response such as xenophobia, for example, related to the closure of borders.
So first of all, with the stigma at the beginning of the outbreak, we also had this stigma more towards people from China, where if they saw someone from China, they would tend to avoid them in at least in the first part of the outbreak. And that's also one of the reasons why I think WHO changed the name of the pandemic to COVID-19 rather than the nCoV-19 or 19 nCoV that it was, or the SARS China version. And you see that with other pandemics as well. We had the Mexican flu that turned out to be the pig's flu in the end, or the H1N1 2009. So we tend to sort of name pandemics to either their origin or towards their whatever country we noticed them in first, the Spanish flu as well, even though it didn't originate in Spain, it sort of got the nomer of the Spanish flu. And that has everything to do with stigmatization in the end, of course. At least one of the results is that you can have this stigmatization. So I think it's, in that sense, the general remark, I think it's very good to see these pandemics in more of a disease rather than origin kind of way, just like we do now with the coronavirus. Here in Denmark, if you're talking more about the local things and stigmatization, it's the borders are closed, but that's not really any stigmatization reason. It's a political choice that was made in order to try to mitigate some of the spread of the outbreak or new cases coming in. So that was definitely not a sort of xenophobic or stigmatization kind of choice that was made. So that's what I know here from Denmark. And besides that, I do know a couple of cases of people that made certain choices in order to avoid stigmas. For example, not going to on holiday in northern Italy, or not going to a certain conference in order to avoid the stigma when they got back. Or you went there, you may have contracted disease, you may have brought it back to Denmark, something like that. I know a couple of people that have avoided those choices. So yeah, that's what I can say about the local, but other than that, I don't think we really have a big problem in that sense here.
There was a question that I was, or an aspect I wanted to bring in actually about, because we are from 3 different continents right now, in a way, it's a question, of course, that translates into a lot of questions. But initially, I would like to maybe challenge you a bit, Maarten, with the idea of statistics as being a sort of socioeconomic filter. Because when you generate statistics about pandemics that talk about how many people got infected and so on, and when you transmit those statistics, in a way you're filtering out all of those people who are really the most vulnerable, because they are outside of the system that is required to be recorded by a doctor and so on. And so I would like to bring in a concept by Gayatri Spivak about, and maybe Catalina can help me here with the exact name of that concept. I think it's about the subaltern. That's it, the subaltern, which is the sort of the other that cannot be seen, and it translates into a kind of north-south divide, in a way a line between the north and the south. And I think this current pandemic amplifies this and really brings it to light, and at the same time filters out a lot of those people who are on the other side of the line, which is a concept by Boaventura de Sousa Santos, the abyssal line. And so this north-south divide, I'm sure Catalina has a lot to say about it, but first of all, Maarten, what do you think about the idea of statistics as a filter?
That's a very interesting question, and from that point of view, yes, when you're using statistics, you're only gonna use or find those people who actually got registered. So yes, if there are people who don't end up in between apostrophes the system, or however you want to call it, you will not be able to see them in the statistics. However, that doesn't mean that we cannot calculate that, because that's basically part of where the statistics comes in. We do know who we registered. That's the numbers. And one of the tricks is to figure out how does that represent the whole? How does that represent those who are not registered? That's one of the big questions that you need to answer with the statistics. And what we do here in Denmark, for example, as well, is to figure out these what we have now called them the dark numbers, basically. Those who we don't know. For example, very, very easily illustrated here is that the people who end up in the hospital are only a certain part of the people who actually got infected. So one of the big questions there is, of course, to figure out how big is the people that, how large is the part of the population that actually got infected based on the numbers that we see in the hospital. Now, of course, that is a more statistical question, and that can also reflect social differences between population groups. There might be some people who are less likely to go to a hospital or less likely to engage in the social healthcare system than others. I do think that here in Denmark and in Western Europe in general, those differences might not be as big as in other parts of the world. Whereas, for example, in the US, we do know that there's a large group of people that don't have health insurances. And those will tend not to show up or less likely to show up in the statistics and may be actually at an increased risk of actually contracting this disease or having more severe outcomes of the disease. And that's just talking about the more wealthy countries. So this might be even worse. It probably is more worse, or at least a bigger contrast in countries that in Africa, for example, or in Southern America, or some parts of Asia, India, where there might be, I'm just calling it a couple of regions here. It's not that I actually know anything specific about it, but I can easily imagine that there might be bigger contrasts there, and that actually, indeed, what you say, that statistics can act as a sort of filter. But it's also the goal, or at least one of the challenges of statistics, to see past this filter. Because if we are good at our job, we have an idea what this filter is. And if we have an idea what the filter is, then we can try to sort of see beyond the filter and see at what the whole should be.
Yeah, it's interesting actually, because this point, or this aspect of it relates to the aspect we talked about earlier with the media, because not only may the statistics be to some degree a filter and require a lot of care to actually depict the nuance of reality, but also the statistics themselves will then be sort of pushed through the media filter and end up in people's heads in a very partial way. And so this is why I would like to address Catalina, because the partiality of quantitative information has been something that we reflected on earlier, and is something that, as an anthropologist, I'm sure you have reflected about. So yeah, just you choose what you would like to talk about.
Yes, thank you. Thank you, Sasha. I think I'd like to connect your question with some of Shrida's question as well about xenophobia. I think if you think statistics, and you mentioned this socioeconomic filter, my view on this is that statistics is a language, just like any other language. And that means it has a cultural filter, inevitable. There is bias on it. We, using statistics, or as statisticians, we need to decide what we want to measure. So we try arbitrarily to create, a way of objectifying what we want to measure. We decide what goes on the numerator, so who gets counted, from which group, that is the denominator. And we always miss out people. It's inevitable to miss out people from that denominator. So some people are not counted. We don't take them into account. And that turns this into a political, exercise, clearly. But if we go back to statistics as a language, it means we use it as a vehicle to communicate things. We use it as a vehicle of, to create knowledge. As we interact through English, for example, we are creating knowledge. We are creating, ideas out of this. We use statistics in the same way. It just has different rules, and you need some level of expertise to use it in what we consider is the right way of using it, but there's also the misuse of statistics. You can have very good use of data, or you can abuse data. So I think that's part of what Martin was trying also to say here. You can have the best statistics, the best multivariate model, multi-level, stochastic, whatever you want, equations, the fanciest ones. But then the question is, why are you using that? What's the question behind that? Because the fanciest model can't overcome if you have very poor data, if you have very poor questions from the very beginning. Why do you want to use these statistics? And that would be my key question behind this, because as any other language, you can't get rid of the bias. I mean, instead of calling it bias, you can say that this is like the same way we have carbon footprint, you can have statistics footprint in a way. There is a print that you leave on any of the phenomena you want to study. But then why would you like to use statistics for that? And connecting this with the xenophobia question that was asked earlier by Juan Camilo, and Shreya a little bit as well. The meaning of xenophobia is really fear of the unknown. When there's something that you don't know how to explain, how to name, how to put a name onto it, how to explain what's going on, the first reaction, a very basic biological reaction, is to fear it, and you need to find a scapegoat for that, and that's when xenophobia, appears. And I think this depends a lot on the words we use to understand what's going on. And there's a very good example related to COVID that is generating xenophobia in other ways. And it's we've been using the term physical isolation, physical distancing, but we're also using social isolation and social distancing. Depending on which word we use, we're talking about very, different things. Governments should enforce physical distancing, physical isolation, but not social distancing. Being separated doesn't mean that we need to be disconnected, as human beings. And the idea of physical, of closing the frontiers, should be based on physical separation, but not on social separation. Because when we jump into social separation, then we have the classical example of xenophobia. We're afraid now of traveling to some areas. We don't know where we'll be able to go to these areas. There are cases of xenophobia against health providers. So nurses and medical doctors who are providing, health care are being discriminated when they enter a supermarket. And behind this is this idea of, should we separate ourselves physically or socially? And we need to be very careful with the words that we use. We should be talking about physical, distancing, not social, because then we run into the xenophobia. And with statistics, well, it's back almost to the same basic question. What do we want to measure? What do we want to be able to provide some light into? And we use statistics as a language to do so, a very, very powerful language. As I mentioned before, information, data is powerful. Governments that lack information lack power. Colombia has lacked power because it lacked information about all the vulnerable communities that suffer, for example, what we've called the internal, conflict in our country. So it's comparable.
So if you allow me to sum up really quickly, and then I'm sure Shreya and Juan both have their final question in the pipeline. So we kind of move from the idea that I proposed of statistics as a filter to what I really like as your idea, statistics being a language, which then kind of went into a reflection on finding new ways or finding challenges to making meaning, and also challenges to creating connection. for example, one strategy would be to talk on Zoom like we are right now. But I'm sure there are a lot of other things that are sort of being tested. It's like a testing period, really. This lockdown for a lot of people in the world, testing different strategies of making meaning and making connection, which is an extremely interesting period to reflect on. So Juan or Shreya, who would like to take on from here?
Yeah, so I also had a point to add mainly. So when you say statistics as a language, I think it's fitting at multiple levels, because like languages also have politics involved. So I think it fits in very nicely. So you also, like how at one point statistics show like how many students have shifted to online learning, or maybe like how people have started going to supermarkets or have stopped food delivery, stuff like that. But then there is also a population that does not have, say, a smartphone or a computer, and so they like go beyond statistics, something that we've already discussed. But I also liked how the politics of it also gets involved. Yeah, and if Juan has a question, otherwise we can just end with final remarks from both of our guests.
So I think the last thing for our guest is the last words that you want to say for the people who are listening to us.
Yeah, I yeah, I actually have a couple of points here, I think. So first is actually basically a slight continuation of the discussion about the statistics as a language. I do like that idea of statistics as a language. However, I see it more as statistics being a tool to use. And you made a comment that there's of course politics in its use, but I would rather see it as the one using the tool of statistics is the one having a political view or a political meaning with it, and thus using it in a specific way. In itself, I would see it more as a tool than a language, unless of course you see language as a tool as well. But then still, I would rather refrain from saying that there's politics in statistics. There's more politics in conveying statistics. But that's just a slight how I see it. Maybe we're talking about the same thing in that sense. And the last thing that I wanted to mention is actually going way back to the start of the podcast, where Catalina mentioned that there are some countries, and I think you also mentioned that your country is part of that, where they may have been structurally deprived over many years of improvements in healthcare, improvements in infrastructure in that sense, in dealing with these pandemics and dealing with these kind of other socially and healthcare related disruptions, so to say. And I think that's a very, very important point to make, that we should definitely take care of improving this base structure, the base infrastructure, and how to deal with pandemics, how to deal with overall basically healthcare, improving overall infrastructure, improving overall economies, and strengthening the basics rather than on the long term, rather than looking for specific implementations. And I think that's one thing that I would like to highlight there, that the importance of having a good groundwork to build upon.
So one thing had to do with these long-term, making decisions and how to invest. COVID as a reminder of where we want to be. And the second comment would be, hopefully in a more positive note, and is that crisis can make us better, people, better societies. In times of crisis, humans can be very, very creative, and wonderful ideas are born because of the crisis that we've experienced before in the past. And some of the major breakthroughs in science and in policy were in part because of all the suffering that we faced before in other moments. So hopefully out of COVID, we'll have great breakthroughs, creativity. And this is not just, a dark period in history. We also need to take out what is very positive, and that's coming out of COVID. That would be my final comment.
I would just like to connect something that you said about to to a quote that a citation that I encountered earlier today when I was watching a talk at Harvard Medical School, which is it was a man called Dr. Farmer, who was a very well-known global philanthropist and a doctor who has worked with the global inequity in global health. And he has quoted W.E.B. Du Bois, who was the first African American to ever obtain a PhD. I don't know if it's the direct quote or if it's just paraphrased, but he said, "The erasure of history is one of the mechanisms by which we perpetuate structural violence." And so I hope, and this is kind of my closing remark, I hope that with we have contributed today to a little bit of historical awareness.
So thank you everyone, thank you our guests for your time. I think it was a wonderful space to dialogue and learn more. And thanks to all the people who are listening to this first episode of Global Voices. We will see you in the next episode. So thank you.
In a country like India, we need very much to talk about the unorganized sector, as it's called, or the informal sector. A great deal of employment in the urban areas, a very large proportion of the employment in urban areas, is not only of migrants, but also employment in the micro, small, and medium enterprises. Now, these enterprises do not have the deep pockets and the access to finance that the big corporations do. To the extent that the government has released its own purse, but especially that the central bank, namely the Reserve Bank of India, has provided additional borrowing facilities to the private sector, most of this, unfortunately, has redounded to the benefit of the large firm or formal sector. It's just unbelievable, because the large firm sector is not the source of the majority of employment in the country. It's a very small part of the employment that the large firm sector provides. And what is immediately needed is sufficient funding and finance, at least in terms of access, but ideally also in terms of the price of finance, a lowered rate of interest. That is what is immediately needed to rescue many, many small enterprises that I'm sure are in the process of dying if they are not already dead. And without that kind of a rescue operation, which will require considerable government involvement, you can't simply leave it to the private incentives of the banking system, which is what the present government is inclined to do. Unless you do that, you could face a very major crisis in terms of employment in the coming months. In fact, the Indian economy has already suffered a very substantial decline in employment, particularly in the informal sector. So yes, we need immediate planning on a war footing to take care of supply problems. We also need to come up with a very substantial, well-funded program to rescue the small firm sector in India, the informal sector, without which there could be a chronic and long-term problem of unemployment in the economy.
Yeah, thank you, Professor. Actually, the last point that you mentioned is the case that is most affecting Latin American countries. such as Colombia. The small industry and informal working is the most critical part that we suffer here in Colombia. And so thank you for that. And so when it comes the dilemma that Mohan described earlier about trying to decide between the suffering caused by the disease and the suffering caused by the lockdown, Professor Ramakumar, do you think that the generational conflict that exists now in many countries could be exacerbated?
Yes, I think so. See, what many countries, I would like to supplement the point that Professor Monrao made from a slightly different angle. If you look at countries like India, what they have done is largely they have announced a small policy on how the government will spend more in the economy. It's so minuscule that it's less than 1% of the GDP. But the rest of all the announcements are regarding the use of monetary policy and not fiscal policy. They are trying to create more liquidity in the system. They're trying to make the banks be able to provide more loans, etc., etc. So basically, what they're using the monetary policy levers as a substitute for fiscal policy interventions. And that has a risk inherent in it, which is the following. A large number of households in India are already, households and companies in India are already in deep debt. Many companies big companies even have failed recently because they have not been, they've gone into defaults. NPAs, the non-performing assets of banking system, have increased significantly, and so on. Given this situation, if you're actually trying to push in more debt into the system, I doubt how sustainable that is going to be. It may be. I'm not saying no intervention is required in credit policy and monetary policy, but what you have to understand is that there is no substitute for fiscal policy sometimes in such cases. Relying on monetary policies, over-reliance on monetary policy may be a very risky strategy. If you look at, say, 2 or 3 years from now, all these loans can explode on you after a point. So the reason why your question has relevance is because the kind of fiscal policy interventions, which will actually put money straight into the hands of people and increase their purchasing power and so on, that is not coming forth from the government. And that is one reason why the economic angle, economic dimension of the crisis is likely to get exacerbated in the next few weeks, particularly among farmers, among informal sector workers in urban and rural areas, as well as the small and medium enterprises that we have. Look, the small and medium enterprises in India are different from the small and medium enterprises across the world because they are still relying largely on informal workforce. They are not on their payroll. They don't pay. They don't necessarily pay the minimum wages. They don't pay any kind of provident fund or any kinds of social security payments as part of they being part of being the payroll. So you can, in the US or in the Western countries, you can actually give a certain amount of money to a company and say you pay the wage of your workers and don't dismiss them. In India, you cannot quite implement such a policy that easily because to begin with, these workers are not in the payroll. They are like the undocumented workers in the United States. They are supposed to be not on the payroll. So there's a lot of black economy out there, unaccounted enterprises out there and workforce out there. To help them is not an easy task for the government. That is why fiscal policy becomes important in terms of universalizing the PDS, ensuring that PDS universalization is not enough. That is, food subsidy being universalized is not enough. It is also necessary that we provide more food to people through community kitchens. That which some states like Kerala have done very efficiently. You need to ensure that infants, people, children who are between 1 and 3 years of age, are provided milk and other protein-rich food in that first 3-year period, for which you need to use what are called in India as Anganwadis, child care centers, where you need to push all your buffer stock, which you're comfortable now. You need to use that food stock, and you should actually be able to take care of the necessities of different types of people. Universal PDS, community kitchens in every panchayat or every village, and massive supply of milk and other food items to children who are at the infant ages. You need a mix of all these things. Only then a strategy will be sort of useful in any form. Thank you.
Okay, so Professor Rao, you have something to say about this, right?
Pick up this thread because it's a very important, critical one at the current juncture. I remind you that the US has a 10% of GDP rescue package announced already in motion, and it's likely to increase further, perhaps to 15%. Japan has a package of 20%. As Ramakumar mentioned, the currently announced initiatives of the government of India amount to less than 1% of GDP. Now, there is awareness on the part of some economists that the expenditure, fiscal expenditure has to increase very substantially, say of at least to the order of 5 or 6%, if not to the order of 10%. My own belief is that it should rise easily to 10% to take care of all the issues that we have been discussing today. Not just food, because that is a matter of universalizing the PDS, but especially of the question of employment via the Manrega program, about rescue plans for the MSME or the informal sector, and also direct cash transfers to the elderly, to the workers, and to the migrants, and so on. So all of this is going to cost money. The one reason which seems to be holding up both official thinking as well as a great deal of private economists' thinking is that how is the government of India going to be able to come up with an additional financing, fiscal financing of the order of 8 or 9 or 10%, or at least 5 or 6 or 7%. I think we can consider several proposals in this regard, all of which are important. So very briefly, the first point is that states are at the front line of the COVID crisis, not the center. You may recall the debate in the United States where Trump claimed that he alone has the authority to open or shut down the economy. But of course, the states resisted, protested, and the result has been a decentralization of the decision whether to maintain the lockdown or not. Likewise, in India, the states are constrained by fiscal limits on how much they can spend. The government of India should immediately release those limits so that the states have larger spending limits and they're able to spend and organize the spending at a local level for the immediate high priority needs. So that's the first recommendation. The second recommendation is that the government of India in particular, but also private economists, need to shed their shyness about what used to be called deficit financing, or what nowadays would be called money financing. In lay terms, roughly speaking, printing money. We need to print money so that government has access to resources and is able to prioritize spending to those areas which have been severely hurt, particularly mass living standards, by the COVID crisis. Printing money is something that governments do in wartime. And if we are in a warlike situation, which I think we agree we are in, then I think we should shed our reluctance to turn on the money financing machine. But this is not a monetary policy in the ordinary sense, because it directly feeds into the fiscal space that the government has. to spend on priority areas. The third recommendation is that the government of India today has a number of what I may describe as white elephant projects, projects which do not really add to the welfare of the population, certainly not in the short run, possibly also not even in the very long run. I have in mind, for example, the bullet train project connecting Ahmedabad and Mumbai. There are a number of other projects which I will not get into here. But yes, significant retrenchment of public spending, wasteful and unnecessary, or certainly not directly oriented to the well-being of the subaltern, as Sasha called them, those should be retrenched as soon as possible. And there are also longer-term fiscal issues that one might want to consider. There's been a great deal of debate in India about the reform and institution of indirect taxes, namely, in particular, the general sales tax or GST. But there's been very little discussion, in fact, zero discussion about the possibility of raising direct taxation, the tax rates on income and particularly capital gains, which mainly accrue to rich 5 or 10% of the population. By raising these direct tax rates and capital gains taxes, the government can provide itself with very ample additional funding in addition to printing money, with which the problems that we have been discussing can be addressed, as I've said repeatedly, on a war footing, because that is what is called for right now.
May I?
Yes, yeah, sure.
Yeah, so I'll just provide a few concluding remarks because I think we are almost close to ending this. We began with the question of food security as a topic. We, like any other outbreak of an epidemic in the past, such as the Ebola epidemic of Sierra Leone or other epidemics in the past, or even the food price spike that we saw in 2008, all of them have resulted in great amounts of food insecurity among the hungry and vulnerable populations. This epidemic has not been different either on that front. That is, there is enormous hunger that is prevailing around us. Governments need to shed all fiscal orthodoxies, come in and use their fiscal policy instruments to spend in the economy to bring relief to people. That is extremely important at this time, number one. Number two, I would like to say that now, so that's about survival. Survival is followed by revival. And revival should be followed in some sense by restoration or to normalcy. When the time of revival comes, we need to have strong economic packages for specific sectors of industries and enterprises where there is large employments involved. So which sector should get most money should be decided by the kind of benefits that it will bring to the working people who have the highest propensity to save highest propensity to spend, because they will immediately spend their wages and it will lead to multiplier effects in the economy. That is one second important point. And when it comes to when you are on the stage of revival, we should also understand that this is the most apt and appropriate time to entrench and expand our a progressive, inclusive, universal social security system. We need a health system like the NHS in every country. In a country like India, the public health system is in shambles. This is the appropriate time to spend at least 1.5% of your GDP on the health sector, to institute a comprehensive public health system, and to move away from the current insurance-based model of public health, which we have in the country, which is largely influenced and guided by these huge luxury private hospitals that are out there, the private insurance industry, and so on. That should be discarded, and the importance of public health should be squarely brought back to table at the end of this pandemic, if at all there is an end. Now, we should ensure that there is a strong social security net so that the poor people, working people, the elderly, women are protected by a strong social security net in the event of a similar crisis emerging in the future, which need not be an epidemic sort of a crisis. It can also be a financial crisis. It could also be a different kind of an economic crisis. So we should be prepared in some sense for that. Neoliberal policy has, over the last 30 to 40 years, consistently dismantled, meticulously dismantled this social security net. We should, in some sense, that policy which existed, that consensus, may I say, which existed in the post-war period, where the role of the working class appreciated much more than it was after the 1970s and 80s, when that consensus was replaced by another consensus called the Washington Consensus. That has been disastrous to people, as we have come to realize now. Workers' movements, political movements, progressive sections of the society, this is the time for them to come out and demand a total rejection of neoliberalism in public policy and bringing back the state in many sectors, which are fundamentally important to the material conditions of life of people. That's my closing comment. Thank you.
Yeah, thank you very much. I think the term post-war consensus is very interesting to ponder at the moment, because there might also be a kind of post-virus consensus, maybe or hopefully. The idea that I would like to mention here now is that we have sort of gotten used to economics being a kind of cult of neoliberal truisms, or we have gotten used to hearing certain economists constantly sort of preaching to the choir of what is in the interest of large corporations and banks. But I think that in a certain state of precarity that we are seeing in the global economy at the moment, there is a certain emancipatory potential, and I'm very thankful that we had now today with us two economists who have explained the different kinds of problems, but also potentialities that are part of this dynamic that we're experiencing at the moment, and the dilemma between health and economy particularly. Mr. Ramakumar has already given us his final thoughts. Mohan, if you want to make a few short closing statements, you can add to Ramakumar's sort of plea at the end, if you want to. Otherwise, we can wrap it up.
To close out our discussion today, I think we have addressed much the most important and crucial issues facing India immediately in the wake of the COVID crisis. Food ranks right at the top, but in my view, this is the easiest problem to tackle, at least for the foreseeable future, by which I mean at least the next 6 to 8 months, because we have ample stocks in the country and the Rabi harvest is coming in very soon. Food. Secondly, employment. Very little has been done by the government in this regard. And this has to be taken up, as I've said repeatedly, on a war footing. Beefing up the employment scenario, even while the lockdown is on, but especially after the lockdown ends, is extremely important. Thirdly, beefing up the safety nets, which are barely existing in India today. The right to food, the right to a basic minimum wage and employment, and a right to healthcare, universal healthcare. So not just universal food rights, but also universal health rights, plus a universal minimum income, whether through employment or through a minimum provision by the government. These three universal rights need to be instituted immediately and as part of the ways of dealing with the COVID crisis. And the last point is that we need to shed the trained in capacities, that is, beliefs which have been dinned into us as unalterable facts of life by neoliberal economics. Those are not unalterable. Those beliefs are not unalterable. I gave you one example, namely the example of the fiscal deficit and how to deal with the lack of fiscal space for the government. So there's much that can be done as part of the crisis response, but which can also be a response for a better long-term future for the country.
So, okay, Professor Ramakumar, you want to say something else?
No, I have made my closing comments, and I agree with Professor Rao that unless we transcend the neoliberal thrust of policies that we have at this point of time, any pro-people initiative will be a non-starter. Workers' movements have, in some sense, their task cut out there, and this is the most appropriate time to strike as well. The iron is hot.
Okay, so thank you both for being here, and this is a very interesting space. And thank you, Sasha and Shreya, to be here also. And thank you, everyone that are listening this podcast.
Yes,
thank you.
Thank you very
Thank you
much.
from me.
Thank you very much.
Thank
It
you.
was very, very pleasurable to hear your expertise and your discussion. And thank you for joining. And bye.
My pleasure. Thank you.
Pleasure. Thank you.
Have a nice day.
Yeah, have a nice day.
Bye-bye.
Bye-bye.
Stay safe, everyone.
Thank you, Sasha.
Bye.